Hi everyone. Recently I had a surgery called LRTI on my right thumb joint, ligament reconstruction tendon interposition. It is a surgery where the doctor removes part of a tendon from your arm and he removes some bone in your thumb joint and he puts this tendon in there and coils it in, and it's supposed to help give you comfort. Many of my friends have been asking about this surgery and what I'm going through and how I'm recovering. So I just wanted to give you a little sort of video diary on that. Because it was my right hand and I'm right hand dominant, it makes it very difficult for me to write. I can't really grip the pencil and I just really can't write yet. And I'm really having difficulty typing, but that is getting better, so that's encouraging. So probably more than 2 years ago, I started having issues with osteoarthritis in my thumb joint. I have it in other parts of my body as well, but I mostly had it in my thumb joint, and it was creating a lot of issues for me. So my doctor at that time, he did an x-ray, showed it was bone on bone, and recommended that I have this LRTI surgery, but I wasn't ready for it. So we tried other methods first. We did PT. We did braces, a hard plastic brace to stabilize the thumb joint. We did a soft brace, which I actually wore a lot, and it also helped to give some stabilization there. And none of that helped a whole lot, but the braces did help some, but I still had pain. So then we did some steroid injections over the course of probably more than a year, because they have to be done so many months apart. And those gave me very little relief as well. So the last thing we tried was at the end of February 2020. My doctor did a lipo injection where he took some fat from my stomach. I laugh and say he didn't take enough, but he took some fat from my stomach and he injected it into that joint. This was done under a local. I was aware and awake of, I knew everything going on. It was extremely uncomfortable. I don't think I'd do that again, at least not while I was conscious. I'd want to be under anesthesia. He did show me afterwards on an x-ray, because it was done under x-ray, what it looked like. And basically they pulled the bones apart, so excruciating pain, pulled the bones apart, injected this fat into there, and it was amazing. There was a good gap in there. It was amazing how much space I had in there again. And we were excited because it seemed to be a success. And I was in a lot of pain. It was wrapped in gauze for, I want to say, 5 days. And then probably by the end of March, beginning of April, I started to notice a difference, and I thought, okay, this is good. And I probably had maybe from April to May, June, about 85% relief in that hand. I still had some pain, but it was so much better. I was super excited and thought, this is great. And then fast forward to July, about second week of July or so. I don't even know if I did anything or what, but all I know is it just out of the blue started hurting horribly again. And I thought, great. So I scheduled an appointment for the end of the month. It was actually our anniversary. I've had a couple things done on our anniversary, so my husband's a saint. And the doctor re-x-rayed it and found that it was back to bone on bone. It was worse than ever. And now the arthritis had now spread in my hand. So the only choice I had left was this surgery. So my daughter, who is a physical therapist in another state, recommended I get a second opinion just because it is a very brutal surgery. So I did, and that doctor recommended a similar but different kind of surgery where it wouldn't have taken as long to recover, but I wouldn't have had the overall benefits of if I just did the LRTI. But that doctor was also very abrupt and abrasive and short, and I just wasn't comfortable with him. My doctor had already done carpal tunnel for me in 2014 on both of my wrists. Can't even see the scars. He did a great job. They're doing great. And he basically does LRTI and carpal tunnel. So I felt very comfortable going with him. So we scheduled the surgery, and I thought, let's do it over the holidays, 2020. Well, that was back in the summertime, and who knew we'd be where we were with COVID. And I still went ahead and scheduled it for November. And I don't know what I was thinking, but I did it. It's over with. That's all I can say. So November 11th, we had the surgery. Um, he wrapped it in a gauze brace for 2 weeks. I was in pain, a lot of pain for pretty much the whole 6-week time. It did lessen some, but it was still a lot. I went back I think it was 2 days before Thanksgiving of 2020, and had the gauze brace removed, and doctor was surprised I was still in as much pain as I was, but I was. So everybody's different. I probably was on pain medicine for a good 3 weeks, and basically it just made me sleepy, but the pain was always still there. My best friend through all of this was Big Blue, I call it. It was a big foam thing that we bought off of Amazon, and basically it kept your hand propped like this, because I needed to basically keep it up for 6 weeks, because otherwise if I had to come down, I would have too much throbbing pain and it would be too uncomfortable. So Big Blue was my friend. Had on that day, 2 days before Thanksgiving, he then put on a fiberglass cast. Now this went over the stereo strips that were still on my hand, so that was a little strange, but I will say I'm 60. I've never in my life had a cast, so this was all new to me. I don't know how they do things after surgery if you need a cast. So that was that. That seemed to be very uncomfortable as well, but I did do the cast for 4 weeks. I think it was about 4 weeks before I could really take care of myself getting ready by myself without my husband's assistance. I was able to start doing my hair, not like today, because each day now I'm getting better, but it was difficult. If I wanted to pull it up in a clip, I had to kind of get it up there, and then my husband still had to put the clip in, but 4 weeks before I could really just do things on my own without his assistance as far as getting ready. Here we are now. I had the cast taken off 2 days before Christmas. It was wonderful to get it off, but I was not prepared for how stiff my wrist would be. So here we are. I'm starting into my 9th week, and 8 weeks out, and I can only bend my wrist this much versus normal. So extremely stiff, can't really turn it very easily. So I still can't grip, and I still can't hold things, and I don't even trust myself to just pick things up, especially any kind of glass or anything, with just this hand. Opening doors, still very difficult, and just a lot of things. So my husband recently went on a trip, so he made sure I had water bottles opened already, because I cannot do that. Peeled eggs for me, because I cannot do that. But I was able to take care of myself fine while he's been gone. I can drive. I still mostly just use my left hand. Yesterday was the first day going to physical therapy that I was able to do the gear shift, but I still needed help with my left hand to do that. So it is improving. It's getting better. I did try to help my pain, which I do still get some now. It's a different kind of pain, and it's a lot of achiness and then the stiffness. And I did jam it the other day, and that was probably a 10 on the 10 scale on the pain scale. Horrible. But PT is helping. I'd see my daughter, but she's in another state, so I go to the local near us here in Hershey, Pennsylvania. And so far so good, and I hope it continues that way. My doctor tells me that in about 2 months when I see him again, this will all be a distant dream, so I'm hoping that's the case. But you can see, and I can't really turn it very well, but you can see, so my scar goes from here up to here. Again, no pins. And it was the dissolvable stitches on the inside. It's looking really good. It's very sensitive, still swollen, sort of that prickly when something falls asleep on you feeling, numb, but each day a little better. Still cannot wear any rings on this hand because my hand is still too swollen, but that's very common. But I'm encouraged, and I'm trying to stay positive. It's not been easy. My husband again has been a saint. but each day a little better. So I hope this helped you if you're trying to make the decision to get LRTI surgery. I hope that this little video helped you to see my journey so it can make your decision a little easier in the long run. Not something to jump into lightly. Definitely do your research. I read a lot of different articles. I talked a lot to my doctor. My daughter talked to her hand PT where she is, and it was all determined that this LRTI is the best way to go if you want long-term, and I think it just froze up there, long-term really good results. So I will try to do another one of these when I'm ready to go back to see my doctor. I believe it's in January, it must be March, February, March, not sure. And just let you know where I'm at then. And so fingers crossed, all goes good. And I hope you guys enjoyed this. Thanks. Have a great day.